Good afternoon, everybody. This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facet staff, I'd like to thank you for joining us today. Today's webinar is entitled Working with Culturally Diverse Students with Mental Health Needs. Today's presenter is Leah Jepson. Leah has a master's degree in social work and is the project director of the Milwaukee Coalition for Children's Mental Health and the executive co-director of Next Step Clinic at the Mental Health America of Wisconsin. Ms. Jepson holds a master's degree in social work and a bachelor's degree in psychology, both from the University of Wisconsin-Milwaukee. Leah has more than 20 years experience in the promotion of optimal developmental outcomes for young children with a focus on prevention and early identification and intervention in developmental delays and child behavioral health disorders. It's my pleasure today to introduce to you Leah Jepson. Leah?
Hello, thank you so much for this opportunity, and hello to everyone out there. I'm going to jump right in because I think we have a lot to cover. So I wanted to frame really quickly that I am not a mental health clinician, that I'm a social worker, home visitor by trade, and I do a lot of systems level work and coalition building. And so that is the lens that I'm going to be presenting this to you today. And if there are clinical questions that we have that come up, I will do my best to make sure that I'm referring those questions out to someone who is the expert to answer those questions. And we do have a lot of we do have a lot of partners who are experts in those areas. So so what I'm trying to do today is to really talk a little bit more broadly about overall children's mental health and where those disparities lie and some of the things that we can do to address them. We're going to touch a little on biases and barriers that could create barriers in supporting our children and families, and especially those who are from diverse backgrounds and more likely to experience these disparities, and then some of the resources available to better support our kids. So I just wanted to go over a few things real quick before we begin, just my own little housekeeping, if you will. In doing this research for this presentation and some work we've been doing over the last 6 months at Mental Health America and with our coalition, doing research on the mental health crisis that we're facing as a country and globally was actually really difficult for me to read and hear, and it was just kind of dragging me down. And so some of this stuff may be really difficult for you to hear. So if that's the case and you're feeling stressed out about all this stuff, please do what you need to take care of yourself. We've been through really difficult times historically, and a lot of us aren't okay, or maybe we're not operating at our best. And so I just want to make sure everybody's practicing self-care throughout the session. If you need to just walk away, if you need to take some deep breaths, doodle, whatever you want to do, just do it. This is being recorded, so you can always rewatch it. If I don't have an answer, like I said, I will do my best to find one. And then there are additional resources for you at the end of the slide deck. It's not like comprehensive. And if there are other resources that you think it would be helpful to share, or if you are looking for other mental health resources, please reach out to me, and my contact info is at the end. So I just wanted to cover that real quick. I want to just give you a little information about the Milwaukee Coalition for Children's Mental Health. So we were founded in 2016 by 10 local, like Milwaukee level organizations with the task of improving children's mental health. And so we're funded through the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin. They actually funded us and 9 other communities in the state. That covers almost just over a third of our counties in the state. So 26 counties 10 coalitions, and then also an academic partner team from the medical college. So we have a pretty wide-reaching statewide partnership that's going on right now. We are in Milwaukee through our coalition. We're focusing on changing the systems that impact our kids that are 0 to 8 in their families. So we're really looking at like that kind of upriver sort of what's impacting our kids early that we can prevent or do early intervention for, rather than waiting until children need to be to receive like really intensive crisis intervention work. Because a lot of this, as I'll talk about, we can do a better job of providing services early and intensively if necessary. We are working really hard in building equity and dignity into our structure of our organization. We are really lifting up the voices of lived experience in everything that we do. And we're really focused on addressing those disparities in child developmental outcomes. So as a coalition, we don't provide any direct services. We do at our clinic, the Next Step Clinic, but but mostly what we do is work in partnerships to leverage resources and really raise awareness of what's going on in our community. So our goal is to improve the mental health of kids age 0 to 8 and that of their families. And I talked about the disparities, but we have these 3 core beliefs that every one of us who intersects with a young child can have a positive impact on them, that we can identify and provide that little bit of extra support or grace or whatever that a caregiver or a parent might need, or that a child might need who's having maybe a bad day. Children's mental health doesn't happen in a vacuum. So children's mental health is very much a function of their world around them. And people closest to the issues that we are identifying in children's mental health disparities must be included in finding the solution. And so those are 3 very important pieces. So that's kind of the lens that I'm coming at this with as well. And I'm going to be stopping periodically to ask questions or answer questions if I can. So I'm just going to go through a little bit about children's mental health, and then I'll stop and bring up questions. And I also will warn you that my dogs may start barking. So, okay. So I just wanted to talk about what children's mental health is. And so when we're talking about mental health as opposed to mental health disorders, children's positive mental health, it involves reaching their developmental and social emotional milestones on track as they grow up, learning ways of coping with any problems or frustrations that they might have, figuring out how to navigate that and those emotions, being able to function pretty well at home, at school, and in the community. And I'm not talking about a child who doesn't have temper tantrums, like developmentally appropriate stuff, right? And then also having a positive quality of life. This is all from the CDC. They talk a lot about how positive mental health is not simply the absence of a mental health disorder, but that there's actually a good quality of life as well that is part of this. So you can have a mental health disorder, right, and still have a positive quality of life. You could also not have a diagnosable mental health disorder and not have a very positive quality of life. So mental health is really an intersection between what you're genetically predisposed for, and your family history and such, and your environment. And that goes for everyone, but children are most susceptible, to their environment. And they're really reliant on others for their care and for their well-being. So I just wanted to make sure that we were providing that basic kind of understanding of what optimal mental health is for kids. Diving a little bit into disorders, they're described by the CDC as serious changes in how children learn, behave, or handle their emotions, and that also cause distress and problems getting through the day. And this is pre-COVID. All this stuff is pre-COVID data. And as I get into a little bit more of that, you'll see that we're not really sure where we are now, but this is where we were pre-COVID. that about 20% or 1 in 5 kids has a diagnosable mental health disorder, and 80% of chronic mental disorders begin actually in childhood as opposed to in adulthood. What's good to know is that there's approximately a 2 to a 4 year gap between when the symptoms of a potential mental health disorder start to show up and the actual like reaching of that diagnosable disorder, where you can where the child or the adult, but the child is has met all of the conditions to be diagnosed, if that makes sense. So the earlier the identification occurs, the better, so that we can get kids treated, get them in for extra support their parents, so they have what they need as well. The most common disorders are ADHD, behavioral problems, depression, and anxiety, and they often occur together. So you can have anxiety and depression. As probably most of you know already, that adverse childhood experiences, or ACEs, and chronic or toxic stress can really compound these issues. So we're talking a little bit more about the environment of how children's mental health kind of occurs. So you get the individual child level, so their genetic predisposition, if you will. If you have a mental health history in the family, or like a traumatic family history, there are children who are more susceptible than others. Some kids can really work through stuff quickly. Others are more sensitive to things. And there are also coexisting disorders that can make it harder to be more resilient to mental health issues. At a family level, like the family home environment is really what adverse childhood experiences are. So untreated mental illness, the loss of a caregiver, so death or incarceration of a parent, child abuse and neglect, and then domestic or interpersonal violence in the home. But there's also this whole piece that's outside of the family, outside of the home, right? And that's in the neighborhood and community level, and then also systemically. And that's where we're really going to be, especially in the systemic context, is where we're going to be seeing where a lot of these disparities are coming from. So, having a safe neighborhood is better for children's mental health. Having housing stability, living in poverty is a risk factor for mental health concerns, and having good social networks and supports is critically important for children and their parents, their family members. And then just a few, there are so many systemic pieces to this, but like, for example, like our children being able to access quality childcare in schools. Like, how is that education system? Are they being bullied in the schools? Do they have mental health supports in the schools? The ability to access care, like, are there a lot of barriers? Racism, systemic oppression, discrimination, historical and intergenerational trauma are also really critically important, and is literally passed down generation to generation. So all of these things kind of come together, the risk factors and the protective factors, and really kind of influence how a child is doing, how their mental health is doing, and their overall development. So some of the disparities that we've been seeing, and I know that there are many more. We're going to be really seeing more of this once more data starts coming through after the pandemic kind of slows down. But so parents of Black kids report concerns about their child's development equally, like to their teachers or to the doctors, but they're less likely to have a medical home or receive developmental screening or assessment after explaining to their provider that they're worried about their kid. Black and Hispanic children who have mental health disorders are identified later, if at all, and especially low-income children and children of color. But when children are both of color and of low income or low socioeconomic status, that's compounded. Children of color are also more likely to be misdiagnosed, so their behavior is seen as a conduct problem or a behavior problem or an intellectual disability other than autism or a mental health disorder. So, they're acting out kind of idea, like, right. And then children of color, especially Black boys, are more likely to miss classroom time because of behavioral issues. So they're more likely and this, you know, if a child of color, um, a child of color will spend more time out of classroom, but if this is a Black child, and especially a Black boy, and even more especially a Black boy with a special education determination, so an IEP, um, as that compounds, that's the more classroom time that they're likely to miss, being sent to the office essentially. And so they get more punitive responses to behavioral issues and needs versus being sent to assessment and care. So some of the things that contribute to our disparities is that there is implicit bias in service provision. The parents report getting their concern, feeling that their concerns are being dismissed, like, oh, they'll grow out of it, especially for those younger kids. The punitive school practices, as I said, or what, you know, some would consider the school to prison pipeline. The more school that you miss, the more disenfranchised children get to school. They don't feel like they belong there, and they're more likely to not to become chronically truant or drop out. And for children of color, especially in Milwaukee, many of these children end up in prison or in, you know, getting murdered or dying early. And this is awful, and we really need to deal with this. So, and I am speaking as a Milwaukee person, somebody who lives here, has lived here for her whole life. But also knowing that locations of services and the lack of providers impacts rural and poor families as well as families of color. But location of services, now with the pandemic, we're learning more and more about telehealth and other ways to create more equitable spaces for people to get care. So if you can't make it 3 hours to a therapist, you might be able to get online and see them like we're seeing each other now. And then it can be really hard to navigate systems and services and benefits, as many of you know. And there are multiple types of stigma that really get in the way of people getting the care that they need, whether it's self-stigma, whether it's stigma that other people have around mental health. It's sometimes really difficult to ask for help. And our parents, we did a focus group a number of years ago with parents who were concerned about their child's development. And one of their biggest issues with seeking help was this kind of self-stigmatization around somehow they have failed their child, or somehow they did something that contributed to their child having behavioral problems or potential mental health issue. And that is normally not the case. And yet parents kind of stigmatize that it's their parenting that led to this. And so these contributions can be internal, they can be external, and some of them are a little easier to deal with than others. So I'm going to stop here and just open it up to see if there are any questions just yet, because then I'm going to dive a little bit into the pandemic and kind of what's been going on.
Well, we do have one or two comments that maybe you can address. And one is that probably you'll be addressing some of this as we go along, but how does one try to break the cycle of such disparities? What kinds of things can actually happen for the cycle to break? Because that seems like that's the most important thing, to stop and start again somewhere else.
Yeah, actually that's in the section after this one. So I will be talking about that more, on how some of the things that we can do to better support children, families, and also create systemic change around this. And it's certainly not, I would actually really like to be able to open it up to other ideas and suggestions, because this can really seem overwhelming and kind of intractable. But I will be talking about that, and would like to open that up for discussion as well.
And then another question, has there been any data on children of color that are not parented by individuals of color and their projections when facing mental health challenges?
So just to clarify, a white parent, or, you know, like a foster child or an adopted child sort of situation, where the child is a child of color, but the parents are white.
Yes, that's correct. Yeah.
I don't have that information. That is one that I'm going to write down right now. And then I will reach out later on this week and try to get that information out there.
And I will ask then the questioner to email directly to Leah so that she has your name and I don't have to mention it over the broadcast
Great.
today.
Okay.
And then the other question that we have just briefly is, oftentimes children with disabilities are forgotten when we're talking about mental health disparities and troubles that they have. And it seems as if children with disabilities are totally forgotten that they have mental health needs as well. Have any suggestions for that?
Yeah. So children who have developmental delays or disabilities are at higher risk for experiencing trauma and for having anxiety and depression. And so while I can't cite exact numbers, we do know that that there are often coexisting disabilities, but then also mental health concerns. And so one thing, we also know that children who have special needs tend to miss more classroom time as well. So as far as suggestions, I think that screening, and I'm going to talk about this later, but depending on the age of the child, making sure that children are being screened, like doing universal mental health screening or social emotional screening for younger kids is really important, because that way all children are getting, just like all children get well child checkups at the doctor, all of those things, that that screening children for mental health concerns is really important, but all of them, not just the ones that a parent may have a concern about, just to make sure everybody's okay, right? I also think that this is something that needs to be in the conversation more often, and that they're not mutually exclusive, right? So in our clinic, in the Next Step clinic, we do autism diagnosis, and we do the assessments, but there's often co-occurring as well with mental health disorders with autism and some developmental delays. So that's another thing too. And so we're really working on trying to raise awareness on how it's critically important for all children to be screened and then provided services or provided navigation services to get the services that they need. And I think that would be especially critical for children with disabilities. I don't know if that helps.
Well, thank you. That's all we have right now, so I'll monitor as we go along.
Sure. And if whoever asked that question wants to reach out, absolutely do so. And I can try to get more information as well. So we're seeing what we as in Mental Health America, we're considering this a public health issue of like what we're seeing, what studies are starting to come out in other countries here, that that as human beings, we aren't doing very well overall since the pandemic started. And so there are increasing risk factors like isolation and loneliness. That's a huge one. Loneliness is a major health risk. It increases morbidity. It is considered, research that's coming up now considers it as detrimental to your health as smoking 15 cigarettes a day. If that puts that into perspective, it's a big deal. Financial instability and job loss. There's like the economic meltdown earlier on. There's major stress on relationships, fear and uncertainty. There's the stress that comes with being an essential worker and being someone who works from home while trying to manage their families and trying to be productive and juggle everything. There is so much grief and loss, like immeasurable grief and loss. Like I can't even, I don't even know what else to say. And there's just been just so much loss, right? And then on top of it, we have the psychological impacts of our racial reckoning in the United States. And there's been a huge uptick in violence against Asian American and Pacific Islander people because of the racism around COVID. So there are these increasing risk factors, and then there are these decreasing protective factors. Social supports are so important to children and adults. Being connected, like social connectedness, so being part of an organization like a faith community, school, work, like I haven't seen my colleagues more than a few times in the last year and a half plus. Reduced access to preventative health care. So like people just stopped going to the doctor. And then also this loss of routine, or like having a really challenging time keeping up a routine when you don't have a commute or you're not going to school, right? Kids get up, they get on the bus, or, go to school, they come home, they have a snack, whatever it is. Like routine is really helpful for our mental health, and especially so for children. And so this is the stuff that like gets a little heavy because we don't have answers yet, and we're not really sure of what we're in for moving forward. Like as the pandemic ends, the mental health ramifications of this unprecedented event will go on for many years, most likely. And so I think knowing about this and being aware about it is really important. The other piece, though, the really positive side of this is that people, I've been in the mental health field for over 20 years, and never before have I seen mental health be such a front and center conversation across the board. Like it seems like everybody's talking about mental health, and it seems like when more people are struggling, it becomes less stigmatized. And it's not a good thing that more people are struggling, but the fact that we're talking about it is huge. It's no longer like something that's whispered behind closed doors. And it's been getting more and more front and center over the years, but there's been this huge leap in funding that's available for mental health, in collective resolve to do something about it, and just identifying it and studying it and seeing where we're at. So that's really important to remember as well. So here are what we know right now about the pandemic and mental health, so people who already have existing mental health disorders are considerably more vulnerable to the stressors of the pandemic. But then also those who have never had a mental health condition in the past are reporting significant symptoms and new diagnoses. The APA or the Psychiatric Association, not the PEDS, they did a national poll earlier in the year, and almost half of all Americans are anxious, worried about contracting COVID-19. This was done before the Delta variant and before vaccines, but I would argue that with the breakout cases and the vaccine has been really helpful, but there have also been breakthrough cases. And I think people are feeling that they are not sure when the next shoe is going to drop. And so I'm not sure that has changed much since the vaccines have come out. 40% are anxious of serious illness or dying, and calls to the National Mental Health Crisis Hotline went up 891% in 2020 compared to the year before. That's massive. And right now the numbers are showing that about more than 33%, about a third, a little more of COVID-19 survivors are receiving psychiatric or neurologic diagnoses within 6 months of infection. And so that's another thing that that's coming to the surface. And so we're seeing a massive uptick in this. And it's being called the shadow pandemic. And so a colleague of mine shared this with me not too long ago, that we had the physical health crisis, that first wave. For us here, it was March. Our economic crisis happened shortly thereafter, and the racial reckoning as well kind of came through at the same time. And so now we've got this third wave. We're still dealing with the economic, the racial crises, the physical crises, but we have this third wave that is a mental health crisis. And it's important that we are on this and that we're aware of this. This isn't like doom and gloom. It's just like, hey, we need to be on this because A, our kids are struggling, B, our caregivers are struggling, and C, our providers are struggling. So like very few people, like I said earlier, are working on, are at their best right now. And so we need to really talk about supporting not just kids, not just parents, but like this whole system. So with children's mental health, there's not a ton of data that's come out yet. They're doing there's some retrospective lit reviews that are being done around previous pandemics, like and epidemics like H1N1 or swine flu, SARS, Ebola, that are definitely showing that children's mental health was deeply impacted by this, because of much of the reason is that their environments have been very much disrupted. So when family and community connections are breaking down, so when their basic needs aren't being met, if their family doesn't have the supports they need, if they're not feeling safe, there are issues, and coronavirus definitely has made people feel not like pretty unsafe. So the aspects of children's lives that really, like I talked about before, that really intersect with children's well-being is their health and development. Their learning environment basically went away, which is also where much of younger children's social emotional skill development comes in. Many families had economic insecurity, and there was a huge decrease in child welfare reports because very few people had eyes on their kids outside of the home. So that has ticked back up. That is, that has corrected itself because kids are going to the doctors now, they're going to school more, and their routines are starting to go back to normal little by little, which is good. The other thing that I really want to talk about is that caregiver mental health, and I touched on this before, is really important because kids' behavioral issues are associated directly with psychosocial risk in their family. So if somebody else is suffering, so does the child. And about 20% of kids have a parent who are living with a diagnosable mental health disorder, whether or not it has actually been diagnosed and treated. And the optimal social emotional development of children hinges on their relationships and the quality of relationships with their caregivers. Those protective factors, it is the ultimate protective factor for child social emotional development and mental well-being. So when they have responsive, consistent, nurturing caregivers, they are statistically more likely to have strong emotional health throughout their life. And if their parent is suffering, they may also be suffering as well. Okay, so that was really heavy stuff. I'm going to open it up for questions again, and in the interest of time, so that we can then start having more of a discussion about what we can do, because this seems a little dark, right?
We don't have any other questions. No, we don't have any other at this time, so.
Okay. So what I would like to do, I'm just going to go through this fairly quickly, but I would really like to have a discussion, if possible, of ways that you in the audience have seen people able to help support families, support children, support our workforce. But I'm going to just go through this. These are just some ideas. So as I was talking about, is that relationships are critical. Relationships are so important for parents and for children, and individuals without children, right? You've got to have a stable and committed relationship with an adult for children to develop and really build that resiliency to overcome serious hardship. And it doesn't have to be the parent. And that's one of the coolest parts, is if the parent is suffering. My mom had a hard time when I was a kid, but I had a grandma who was there and she was awesome. And that helped offset. It was a protective factor for me when my mom was struggling with her mental health, just to put that in like a personal frame. And I really like this quote, that human relationships and the effects of relationships on relationships are the building blocks of healthy development. So talking about supporting our children, we need to really, really fund and support safe environments for kids, because positive experiences will buffer against these negative effects of stress. And when they are able to see executive functioning skills modeled by somebody, so to see an adult be able to control their frustration, to be able to say to children like, oh, it looks like you're having a rough day. Do you want to talk about it, right? That helps children find their words and really helps children be able to express themselves. For older kids who have words, it's really helpful, but also for younger kids who maybe don't have the words to frame their emotions or their experiences, or their feelings rather, having an adult, a caring adult, say, like I said, looks like you're having a tough time. It really helps validate their feelings and really helps model that it's okay to have these bad feelings. It's how we deal with them that matter, right? I talked about this earlier, universally screening all children early and regularly for developmental and social emotional concerns are really important. When we miss those first 5 years of development, children enter school with undiagnosed mental health disorders or developmental delays or both. They've already missed so many years of this critical brain development time, that where they could be getting intensive interventions, parents could be getting support, right? And so while I know we're talking about school age children, I think if we go upriver and we really look at the critical ages, those neural development times, all of these things that go on from infancy through about year 5, reaching those children is really important. And if we have it built into our systems that we just screen kids, that in itself is really, really good, right? In the last maybe 4 or 5 years, Children's Wisconsin has started, like in their clinics, they're screening all their kids with the ages and stages questionnaire, and the MCHAT for autism. Aurora also, Advocate Aurora now is also doing that. And so these are systemic things that are being built in to really help support our children. But parents can also, if parents know about this, right, they know about screening, they can ask for it as well in case they're not getting it. Quality school-based mental health supports are really important. There's in Milwaukee, we have the School Community Partnership for Mental Health that pairs clinicians with schools. So Mental Health America is providing clinicians. Children's Wisconsin was, Advocate Aurora. And so there are a number of clinical providers who are partnering with schools to actually be in the schools, working with kids and their parents as they have struggles. And so to be able to expand that would be just beautiful across the state. And then also, and these are kind of all over the place, but identifying the meaning behind the behavior. So if we as if we're at a grocery store, or we're teaching in a classroom, or we're at an event and we see children behaving badly, to really, really be able to understand the meaning behind the behavior. Like they're not a bad kid. Maybe they're having a bad day. Maybe they're having a rough hour, right? Um, and so some of these are like larger kind of systemic things, right? But then there are also things that we can do individually to reframe how we think about behavior or how we think about parenting, and maybe give that extra smile or that extra support in these situations with total strangers, right? And then for those of you who know kids and have them in your lives, I'm guessing most of you do, to really intentionally check in for those older kids, not toddlers as much, but for older kids, like check in on how they're doing, how connected are they feeling. The Office of Children's Mental Health came out with an amazing fact sheet last month on social connectedness for children. And I have a link to it in the resources. They also have one, which is my next slide, on parents, how we can support our parents better. And I strongly suggest checking it out. They're 2-page infographics. They have really good, like, up-to-date statistics and responses that we can have to help make sure kids are connected, parents are connected and supported. And then if it's your child, seek services if you have a concern. Don't be afraid. If it's somebody you know and care about, start that conversation. Just bring it up. And if you've already been through it, if you have that lived experience, whether you're parenting a child who has been diagnosed with a mental health disorder, or if you yourself as a parent are struggling with mental health concerns, and you feel like you can share that, because that really, really helps when people feel that they're not alone, and that there are people who have also been there. It's remarkably helpful. And then for caregivers, if you're a provider, see the parents as an expert on their child. Like if they have a concern, they are with their children so much. Listen to them, hear them out, even if you disagree. Provide screenings and linkages to services if they're also struggling. Parents, we have a community advisory board of parents who basically vet all of our services and share their experiences trying to get services for their child or for themselves. And it having that feedback has been huge. That, a lot of parents that we've talked to say, well, I knew there was something wrong, or there was a concern. I asked, I got a phone number, and then like couldn't get a hold of anybody, or they got to run around with their Medicaid or their other insurance. And so as a provider, to be able to kind of make that warm hand up, to make sure that parents are getting those extra supports, so it's not just like, here's the number and then out the door, that can really help ensure that parent will be more likely to link to actually take up services. To provide, and this is another systemic one. This is something that we're doing at the clinic, and it's providing family navigation service to better connect families to services and resources. So instead of just a warm handoff, to actually have staff like community health workers, for example, who know the services in the community, who know the community that they're serving, and are able to build that trust and really connect families to services is really, really important. It's also expensive. So we also need advocacy to fund it for mental, for Medicaid and private insurances to actually fund these services, because they really make a difference in building bridges between parents and services and those systems of care. Again, I can't say it enough. Lift up the voices of people with lived experience to address these barriers to care, and support policy change. And just a few of them are reducing poverty, which is no easy task. Expand parental medical leave. Housing is critically important, and increasing funding for mental health services. And then I just have I'm gonna skip this slide because I do have a link to it, and I want to make sure we have 15 minutes left. I want to make sure that we actually have time for a discussion. But these are also for caregivers, for parents, these are the 5 protective factors. And the Center for the Study of Social Policy has great resources on that. And then also, I just included a few for supporting our providers, because as I said before, everyone is struggling. Most everyone is struggling anyway. So if you are a provider, self-care is critical, right? But also make sure that you're taking up services that can support you in doing your job, right? And make sure that your mental health is okay. Get help if you need it. But for people who are supervising or running programs, to offer supportive services to people who are caring for children, like in a classroom setting, especially teachers. We're hearing from childcare providers, we're hearing from elementary school teachers that they're struggling too. And the behavior of children has become more challenging as they're trying to reintegrate back into classrooms. It's not an easy transition. This has been a very trying time. Provide mental health consultation to providers regarding children's mental health and challenging behaviors, like reframing tools, ways of doing this. St. A's in Milwaukee has come up with some really great toolkits for providers in the classroom, like for early childhood educators, and then for classroom teachers in education, to offer them in classroom supports and tools so that kids can stay in the classroom even if they're having a hard time, to prevent them from being isolated or feeling marginalized and missing really important classroom time. So those are just some suggestions. What I want to do is open it up and just for comments or anything else that you would like to say. Maybe we can have a discussion. So you're not just sitting here listening to me talk.
I do have a comment on the different types of assessments. So the questioner says, personally, I feel screens may be skewed. They are completed by parents at the doctor. If those parents are struggling, it causes an inaccurate assessment. Is there any talk about better ways to perform these screenings?
So if we're talking about like an ages and stages questionnaire, those are actually found to be really reliable, and they have inter-rater reliability. So we use the ages and stages, the ASQ3, and I think that, how do I say this? I don't want to be dismissive of this question at all, because I think it's an excellent question. Parents know their children best, so their self-report is the best we're probably going to have as far as universal screening. And it's okay if a child comes up with a delay and then they get a more in-depth assessment by a professional to look at, whether it's fine motor or speech, that's okay, right? They can get that extra support, and if they don't need it, they don't need it, which is awesome, right? But I guess my bigger concern would be to not screen children, or to do so in a way where parents are more excluded from the process. For developmental screening, best practices is having it be parent completed, not provider completed. Although it does work really well for parents to have, if they have a home visitor, for example, to have somebody walk them through it and provide a little more information. Like, for example, if a family does not have stairs inside of their house, you're not going to be able to answer that question of whether or not your child can do stairs yet, climb upstairs or downstairs. So I don't know that how would I say this? I think the best practice is to have parents complete the screenings with the support of a professional. That would be optimal. However, we are getting less and less and less face time with pediatricians and other providers, health providers, as we go forward. Like I get like 15 minutes with my doctor, right? If you're going in for a pediatric appointment, you may not have a ton of time with them. And so I think filling it out together is probably the best way to do it if we could figure out a way to give doctors and other professionals more time. Yeah.
And just as a follow-up to that, the person went on to say that knowing from personal experience that certain parents have a tendency to minimize things due to shame or stigma.
So, right. And that I think would come in more with the ages and stages social emotional. The ASQ3 and the MCHAT for autism, modified autism checklist. I can't remember the exact wording for the name of that because I've been calling it the MCHAT for so long. But those are very, very subjective. Like, can your child pick up a Cheerio? You know, like really subjective. But with that, I do agree that with the social emotional one, I'm sorry, the really objective, the social emotional screener, the ages and stages SE, as it's called, or SE2, is much more subjective and also much more stigmatized because it deals with behavior. It deals with potential mental health or social emotional development concerns. And what we have found as best practice is that that is done in the context of a trusted relationship. So whether it's a home visitor or a family navigator, someone where the parent trusts that person and feels that they can share fears, a peer support person, those folks are more likely to have that trusted connection with that parent to be able to provide that extra support and that kind of real conversation and really address stigma or address those fears. Doing them in the context of maybe like a medical provider or a school, depending on the amount of trust that a parent has with that system, whether it's medical or educational, if they're not trusting the teacher or they're not trusting the doctor, then yes, you're absolutely right that things might get minimized or skewed one way or another, and that absolutely can happen. And one of our big systemic issues with not just children's mental health, with adult mental health as well, and those especially around racial disparities, there is so much trust that has been lost with between the healthcare system and parents of color to because of white supremacy culture, systemic racism, the bias, and also historically the unethical testing on people of color, Tuskegee. We have all kinds of examples of this, that trust has really been eroded, and our healthcare systems have really been built by white people, overarchingly built by white people, and much of our medical field was white men, right? So there have been, and this is not me trashing anybody, but it's like historically.
Leah, we're having a little bit, yeah.
Oh, sorry, are we having issues?
We're having a little trouble with the audio now, so we may not have gotten everything that you said. Let me do a test now. Will you try to just talk one more time, please?
Yeah, can you hear me okay?
Yeah, we're just cutting out a little bit now. Let me try and give you, maybe it'll clear itself up here. And let me give you another question and see if you're able to hear that and be able to comment on it. And
okay.
I apologize if we're unable to do that. Right now, this person, the questioner and comment says, important right now, learning to be aware of and approach youth experiencing a mental health crisis. I recently went through youth mental health first aid training, which was extremely helpful. In the past month, I came across and connected with 2 youth having suicidal thoughts who had to be, had not told anyone else. So this person felt more able to address those needs, I believe.
Yeah, that is fantastic. We prevent suicide.
Yeah,
Wisconsin.
we're still having audio trouble here, Leah.
Oh
I
no.
don't know. Um,
And I can hear you guys fine.
yeah, I'm going to have to apologize for those of you that are still on and not able to hear.
What I could do,
Maybe, Leah, we can just display some of the resources that you have, because we're almost to the end anyhow, and I just all of a sudden need to apologize. I have no idea what's happening.
I'm sorry. um, we have,
Actually, I can't, I'm having trouble hearing you, but for those of you who can hear me, Leah is displaying now the resource page of her presentation and the information that's provided to you. What I'm going to ask at this point in time is just to have people review this. If you have questions, please feel free to contact Leah, because she has told me that that's okay to do so, and that there's early childhood mental health resources that she's displaying for you at this time. And then Leah, maybe you can also display at this point some of your contact information. Yeah. And we can try to have you comment again. I don't know if that's going to work for us. I don't know what happened.
can you hear me at all?
Oh, now we can. All right. So,
Oh, I don't know what is going on.
but if you want to make just a closing statement, because we only have a couple of minutes anyhow, we are able to
Yeah,
hear you at this time.
I don't know what you guys heard from me last. So please reach out to me if you have questions. I am on vacation till through Friday, but I will be back on Monday answering my emails. This is my personal or my work email, leah@mhawisconsin.org. Mental Health America and we have suicide resources, suicide prevention resources, and links to the youth mental health first aid, which is a fantastic class training. The more people that feel comfortable asking how people are doing, the better, right? And so if you also go to Prevent Suicide Wisconsin, there are a ton of resources there as well, and linkages to trainings for that.
Yeah.
So I
I,
apologize for
since
these.
Well, since we can hear you again, I do have another comment. Maybe we can do, we have like 2 minutes left. The person says, supportive peer connections are hard to build in online learning environments. Now, it's critical to check in with youth because they are not, having to be able to share thoughts and feelings with someone personally.
Yes, that is absolutely right. And I think we still have to ask. And I mean, some schools, I've heard anecdotally that some schools are actually individually contacting kids just to do a check-in and see how they're doing, like their teacher is. I don't know how they make time for that, but I think that we need to really be aware that if we don't ask, we might not find out, right? Like talking about mental health can be really difficult for people, and so again, I can't emphasize more that if you have neighbor children, if you have children in your life, just to see how they're doing, see how the parents are doing, check in with yourself as well. because we have to, as providers and advocates and parents, we have to put on our oxygen mask first, right? Before we can help anyone else. And I just got off a plane earlier last night, and that I think that that is like the best thing that we can remember, is that we have to make sure that we're okay before we're going to be able to help someone else. So check in with you, check in with those that you love and those around you. And yeah, and I really wish I had another hour to talk with you about this.
Well, we'd like to take this opportunity to thank you, Leah, for your presentation today. Apologize to all of you because of the bit of the blurb that we had as far as inability to hear there. We have no idea what happened, although some people are telling me they were able to hear okay, but others are telling me they were not. So we apologize for that. Again, thank you, Leah, and thank you for offering the opportunity for people to contact you directly if they need to. So we appreciate that. This will conclude our webinar for today. We'd like to thank everyone for joining us. Please be reminded that Wisconsin Facets has over 100 scheduled trainings and webinars. And please check out our website calendar and register for any of those upcoming trainings that may be of interest to you. Also, please watch for the short evaluation that will be coming your way after today's live presentation. Again, thank you to everybody. Thank you, Leah. Everybody have a good day. Be safe and be well. Bye-bye.